2021 has been a magnificent year and has moved us closer than we ever thought possible to our dream of regulated psilocybin and psilocybin therapy for all Canadians in medical need. We've accomplished so much this past year, and we have you to thank.
This year at TheraPsil, we've had the opportunity to connect with so many individuals wishing to access legal psilocybin therapy. We've had the privilege to learn about their lives and to hear beautiful stories of newfound hope, healing, and transformation. To those who we've been able to connect with directly, thank you for trusting our team to support you.
2021 was a big year for TheraPsil. One of the most noteworthy milestones happened quite recently when Minister Jean-Yves Duclos and Minister Carolyn Bennett granted the first non-palliative Section 56 exemptions in nearly a year. Also noteworthy was the launch of our training program, the launch of our research, which is going to provide quantitative and qualitative observational research on the patients getting access to psilocybin through Section 56, and also the submission of our proposed psilocybin for medical purposes regulations.
I want to personally say thank you to all the incredibly brave patients who have chosen to publicly or anonymously share your story of applying for and accessing legal psilocybin therapy. Your courage has brought this treatment option out of the shadows, and through your steadfast education and advocacy, you've helped potentially thousands of others who need compassionate access, both now and in the future.
Thank you to our Canadian healthcare professionals, our amazing trainers and trainees. We don't know what we would have done without you this past year. Thank you for trusting us, for your continued support, and for the countless hours you spent advocating for exemptions and regulations this past year.
I would like to thank McGill University, Northern Ontario School of Medicine, Vancouver Island University and Imperial College London. With your dedication and expertise over this past year, TheraPsil has been able to launch its first ever research collaboration. We're excited for this research to evolve and that the data we collect from this study will greatly help to advance our understanding of how the diverse elements in guided use of psilocybin may facilitate psychological change in patients experiencing end-of-life distress.
Thank you also to our engaged community of over 15,000 people on social media who have followed our work, liked our content, tagged the health minister, and shared our posts. Every single like, retweet, and follow has helped move the needle and expand the reach of our message.
This year, we're also able to launch a psilocybin-assisted training program, expand it Canada-wide, and train 125 healthcare professionals to support patients with legal access to psilocybin-assisted therapy. Thank you to everyone on our waitlist. We really appreciate your patience as we look to scale the program. We look forward to working with you soon.
Thank you also to the team from Island Health who worked diligently to create a detailed engagement survey to inform patient-oriented research with psilocybin. As TheraPsil has and always will be a patient-centered organisation, it was such a pleasure to work alongside the creation of this project.
To those who have reached out to TheraPsil that we haven't been able to help yet, we want you to know that we continue to advocate for you. We continue to build a future in which psilocybin is accessible. We continue to fight for legal psilocybin to be available for all in medical need. To those who have advocated for legal psilocybin in any way, we want to thank you. Maybe you've spoken publicly about your story, your journey on a blog, a podcast, a webinar. Maybe you've connected with your MP directly or written them a letter or an email. Maybe you're speaking openly with your family and your friends and your community about psilocybin.
I'd also like to give a big shout out to the many writers, journalists, and reporters who have chosen to amplify the stories and voices of patients and healthcare professionals who are advocating for legal access to psilocybin therapy. Your articles, videos, and news stories have helped normalize the discussion around therapeutic psychedelics, both in Canada and internationally, reaching conservatively hundreds of thousands of people.
Speaking of international, I also want to recognise and thank our friends over at Drug Sciences in the UK for your endless support. With your guidance and suggestions, TheraPsil was able to commission and publish our own public perception poll this year. We look forward to staying connected and for the many exciting collaborations that the new year will bring.
This is also a time, wrapping up the year, to be incredibly thankful for our former Minister of Health, Patty Hajdu, as well as our new Minister of Health, Jean-Yves Duclos, and Dr. Carolyn Bennett. These ministers have acted with compassion and have been courageous responding to patients in medical need and providing them legal access to psilocybin. We thank them and we look forward to continuing to work with them to establish further medical access in 2022.
I also owe gratitude to the team members and volunteers who worked on drafting medical psilocybin regulations. It was such an incredible experience to learn from your expertise and to work alongside you to create a proposed access to psilocybin for medical purposes regulations. I'm excited to continue this important and exciting work into the new year.
And thank you to everyone who has attended or shared one of our 21 webinars over the past year, and to all the incredible panelists who we had the honor to chat with in our webinar series.
I'd also like to thank our board of directors, who helped us stay focused and supported on key strategies this year. Thanks is also due to our donors, who gifted us big donations and smalls. These organizations have financially supported us and allowed us not only to continue our work, but also expand it. I think it's fair to say that we're deeply grateful for your gifts, and that we simply would not exist and couldn't continue our operations without you.
We are all way more connected on this planet than we tend to comprehend, and every action, even if they feel small, makes a big impact. I want to remind you that your voice is powerful and your story is important.
I would like to say thank you to the patients and healthcare practitioners who are at the center of all of this. Without your courage and bravery, we would have never been able to get access for over 81 Canadians. It is because of your bravery and putting your medical conditions and your careers out on the lines for other people that so many were able to get Section 56 exemptions. Thank you, thank you, thank you, and we look forward to working more with you in 2022.